Hyperacusis, also spelled hyperacusis, is a health condition characterized by an increased sensitivity to a certain frequency and volume ranges of sound, a collapsed tolerance to usual environmental sound. A person with severe hyperacusis has difficulty tolerating everyday sounds, some of which may seem unpleasantly or painfully loud to that person but not to others. It can be acquired as a result of damage sustained to the hearing apparatus, or inner ear. There is speculation that the efferent portion of the auditory nerve olivocochlear bundle has been affected, efferent meaning fibers that originate in the brain which serve to regulate hearing. This theory suggests that the efferent fibers of the auditory nerve are selectively damaged, while the hair cells that allow the hearing of pure tones in an audiometric evaluation remain intact. In cases not involving oral trauma to the inner ear, hyperacusis can also be acquired as a result of damage to the brain or the neurological system. In these cases, hyperacusis can be defined as a cerebral processing problem specific to how the brain perceives sound. In rare cases, hyperacusis may be caused by a vestibular disorder. This type of hyperacusis, called vestibular hyperacusis, is caused by the brain perceiving certain sounds as motion input as well as auditory input. Although severe hyperacusis is rare, a lesser form of hyperacusis affects musicians, making it difficult for them to play in the very loud environment of a rock band or orchestra which previously gave them no problems. It also makes attendance at loud discos or live events difficult for a portion of the population, given that sound levels at such events usually exceed recommended safe levels of exposure. This is a problem that may be caused by genetic differences, stress or ill health, or by abnormal responses in the tensor tympani, tonic tensor tympani syndrome, and stapedius muscles, which function in the normal acoustic reflex response that protects the inner ear from loud sounds. 25% of people with tinnitus report mild hyperacusis. In cochlear hyperacusis, the most common form of hyperacusis, the symptoms are ear pain, annoyance, and general intolerance to any sounds that most people do not notice nor consider unpleasant. Crying spells or panic attacks may result from cochlear hyperacusis. As many as 86% of people with hyperacusis also have tinnitus. In vestibular hyperacusis, the person may experience feelings of dizziness, nausea, or a loss of balance when sounds of certain pitches are present. For instance, people with vestibular hyperacusis may feel like they are falling and as a result, involuntarily grimace and clutch for something to brace themselves with. The degree to which a person is affected depends on not only the overall severity of that person's symptoms but also whether the person can detect sounds in that frequency range at the volume in question, as well as on the person's pre-existing muscle tone and severity of startle response. Anxiety, stress, and/or phonophobia may be present in both types of hyperacusis. Someone with either form of hyperacusis may develop avoidant behavior in order to try to avoid a stressful sound situation or to avoid embarrassing themselves in a social situation that might involve noise. A person with hyperacusis might be startled by very low sound levels. Everyday sounds like shutting doors, ringing phones, television, running water, ticking clocks, chewing gum, cooking, normal conversation, eating, dishes, and other sounds will cause varying levels of annoyance and can potentially pain the ears. The most common treatment for hyperacusis is retraining therapy, which uses broadband noise. Tinnitus retraining therapy, a treatment originally used to treat tinnitus, uses broadband noise to treat hyperacusis. Pink noise can also be used to treat hyperacusis. By listening to broadband noise at soft levels for a disciplined period of time each day, patients can rebuild, i.e., re-establish their tolerances to sound. When seeking treatment, it is important that the physician determine the patient's loudness discomfort levels, LDL, so that hearing tests brainstem auditory evoke response. If people have access to medical care, steroids are used to treat hyperacusis within 72 hours of the onset of the condition.